Hi, and welcome back to Among Therapists, Practical Tips by Psychotherapy Academy. I'm Dr. Jessica Díaz, and I am thrilled to guide you through another insightful episode. In today's discussion, we're exploring the intricate treatment of complex PTSD, emphasizing the necessity of a trauma-informed approach. Our focus will be on Judith Herman's influential three-phase model of trauma treatment, a method that has reshaped how we address complex PTSD. We'll examine the importance of the first phase, stabilization and safety. Overcoming dysregulation and establishing a sense of safety are paramount for beginning the healing process. The second phase centers on processing traumatic memories, an area where our understanding has evolved significantly. We'll explore how this is not just about recalling memories, but coming to terms with them. Lastly, we delve into the third phase, integration and meaning. This phase is crucial in helping individuals understand themselves post-trauma and find meaning in their experiences. Additionally, we'll discuss various popular treatments for trauma, like EMDR, IFS, and somatic experiencing, and their effectiveness in different PTSD scenarios. We'll also touch on the reasons some treatments, like prolonged exposure, may not be suitable for certain complex PTSD cases. Our faculty member, Janina Fisher, Ph.D., a renowned researcher and professor in the area of trauma and a licensed psychologist, will be sharing her expertise on these practical strategies. With her extensive background in trauma treatment, Dr. Fisher guides us through these impactful approaches. To enrich our understanding, Dr. Fisher discusses the rationale behind choosing trauma-informed stabilization treatment for a particular case. We're excited to announce that this extract is part of our new trauma training pathway, proven ACT, DBT, and prolonged exposure techniques. Embark on a journey to master trauma therapy through various evidence-based frameworks. This training program emphasizes practical knowledge, allowing you to transform these theories into actionable strategies for effective trauma treatment in complex scenarios. Enhance your trauma therapy skills now with our three-dimensional e-learning program and earn up to 30.25 CE credits. Without further ado, here's Dr. Janina Fisher.
Let me talk about the implications for treatment. Obviously, with a diagnosis of complex PTSD, a trauma-informed approach is the most appropriate for this client. We also know that she had not done well in treatments that were not trauma-informed, so that also implies a trauma-informed treatment approach. I always want to take into account what has worked and what has not worked in previous treatment. In the trauma field, we have been influenced very profoundly by Judith Herman's phase-oriented trauma treatment model. Her reworking of a trauma treatment phase-oriented approach first proposed by Pierre Janina at the end of the century. Phase 1 in this model, before we address the trauma, the first stage of the work is a stabilization, helping individuals to overcome the autonomic dysregulation, the attacks on their body, the suicidality, the addictive behavior, establishment of a safe environment, because we can't recover from trauma if we are still in an unsafe environment, and the establishment of emotional and autonomic stability, the ability to tolerate and regulate emotion. Because how can individuals address traumatic material if they can't tolerate day-to-day stress? The second phase of treatment was focused on traumatic memory. And what we have come to define as traumatic memory has changed over the course of years. At one time, we thought back in the 90s, we thought that treating traumatic memory meant retrieving all of the memories in all of their details. And as the field matured, we came to realize that remembering was not the same as recovering. And that the important thing about this phase is coming to terms with the past, whether it's coming to terms with the events or coming to terms with the implicit memories. And then the final phase, Judith Herman called the phase of integration and meaning making, coming to terms with who we are as a result of the trauma, helping individuals to find meaning in their life choices, whether raising children in a nonviolent way, pursuing a social cause or a career focused in some way on justice or healing. Now, there are many, many treatments for trauma, ranging from psychodynamic and psychoanalytic treatment, supportive psychotherapies, EMDR, eye movement desensitization and reprocessing, which was developed in the mid-'80s and became popular beginning in the 90s. Internal family systems, which has again first was described in 1995, has recently become extremely popular. And then somatic approaches to trauma, very, very important in the light of Bessel van der Kolk's book and mantra that the body keeps the score. So we have many treatments to choose from. Some are evidence-based. EMDR is evidence-based. It was developed by an experimental psychologist, so its effectiveness is well tested. Prolonged exposure has a very good evidence base, but because the evidence base rests on research with subjects who did not include any trauma survivor with an addictive disorder, with self-harm or suicidality, dissociative symptoms, a history of hospitalization, psychotic symptoms. It is not been tested on complex post-traumatic stress. The research is based on subjects with simple PTSD and none of these exceptions. There is an evidence base for IFS, but it's a study of the use of IFS with rheumatoid arthritis patients. And then somatic experiencing has two randomized controlled studies. And so it has an evidence base if that's important to you. Because we also have treatments that are more popular with our clients. And when we're deciding what treatment to use, we have to think about, is this a treatment that my client will complete? Will this treatment speak to my client? So I could easily rule out many treatments because there's a very high dropout with prolonged exposure because of its intensity. Also, prolonged exposure works on one memory at a time. And so for clients with complex PTSD, often they have endured hundreds of traumatic events. And so for them, prolonged exposure is not a good choice. Supportive psychotherapy had been tried. Psychodynamic trauma-focused therapy had been tried. The EMDR had dramatically exacerbated her symptoms. She also had not done well with internal family systems. I wasn't sure if that had to do with the fit with the therapist. But what I also know is that internal family systems requires more affect tolerance than my client had. And she was so intellectual that a somatic approach, aspects of somatic approaches were helpful for her, but a purely somatic treatment would not have been a treatment she could tolerate.
Okay, so that was a comprehensive exploration of complex PTSD and trauma-informed approaches in today's episode with Dr. Janina Fisher. We've covered the critical three-phase model, emphasizing stabilization and safety, processing traumatic memories, and integrating and meaning-making in the healing journey. Our journey included an exploration of various treatment modalities, their effectiveness, and their rationale behind selecting appropriate methods for complex cases. We also discussed why specific treatments might be less effective or inappropriate for complex PTSD, highlighting the need for a tailored approach. The insights shared today underscore the importance of a nuanced, trauma-informed methodology in treating complex PTSD, catering to the unique needs of each individual. Knowing the forefront trauma therapy skills isn't just about expanding your expertise. Imagine the feeling of confidence and fulfillment as you help one trauma patient after the other get back on their feet and finally feel like themselves again. Our new trauma training pathway, proven ACT, DBT, and PE techniques will help you gain the confidence and skills to tackle even the most complex scenarios in the world of PTSD and trauma. With our three-dimensional approach, you will get a comprehensive training in acceptance and commitment therapy, dialectical behavioral therapy, prolonged exposure, plus a bonus on trauma-informed stabilization treatment to enhance your therapeutic skills and upgrade your clinical practice. Enroll now and earn up to 30.25 CE credits on completion. If you're a psychologist, counselor, social worker, physician, or nursing professional, these credits are accepted by your professional board. You can click the link in the show notes to learn more about accreditation and the training. You can also access exclusive content which isn't covered in this podcast. This is an on-demand training, and all modules are available in multiple formats. You can watch videos, listen to audio, and download PDF transcripts. If you enjoyed this podcast, please help us spread the word by leaving a review on Apple Podcasts and sharing news of it on your social media. We are so grateful for your support. Thank you for listening. This was Dr. Jessica Díaz. See you soon for the next episode. Bye-bye.